you doing?
He's doing pretty good. His appetite has been off.
Okay.
Lately.
Yeah, let's pick up this handsome man.
Come on.
Perfect. He's trying to get away. They're pretty
Yes.
good at it. You can put him right.
Oh,
Yep.
okay.
Yeah, no big deal. I got him. Oh, you're a big boy.
Yes, he is.
Oh my goodness. 25 and an ounce.
He gained weight. I
Yeah, he
believe it.
did.
And
He
he's been
did.
eating-
Swifty is in today for a wellness exam. He has no history of a distemper vaccine, so we definitely want to know about that. He also, per owner, says not eating very well, kind of a little bit lethargic in terms of activity around the house, and he's on some medication. It's just not doing the job anymore. So we're just going to take a look at some blood work and make sure that he's doing okay and what we can do to help him out and change around his medication.
a quarter cup or a half a can. As far as his pooping, it seems to be okay, but his appetite hasn't been what it was a couple of weeks ago.
Okay. All right. So today we have Swifty, a male neuter domestic long hair. He's presenting for a physical and update on his RCP and a fecal. However, owner has also mentioned that his appetite has decreased, but he's still gaining weight and very active. He's got a really good history of constipation and obstruction down in that area, so we're thinking maybe something like that, although owner claims that bowel movements have been normal in the litter box. Otherwise, he's very healthy. He's drinking normally. He's eating food, just not too interested in food. No coughing, sneezing, vomit, or diarrhea. And doing well on medications. He's just kind of on a maintenance of lactulose 3 mils twice a day, and Miralax. Owner's been giving about 1/4 of a teaspoon twice a day, and she thinks that it's working, but maybe not as well as it has in the past.
Okay. All right. Let's give it a check. Hi. How you doing? Good to see you again.
Yeah,
Everything good?
everything's good with this guy so
Okay.
far.
Good. Good.
I'll be bringing the other one back, so.
All right. So I understand that we're basically just here for vaccines, and
Yeah.
but we are having a little bit of weight gain,
Yeah.
but
understand,
decreased amount of
because
food.
he's on a special diet. He only eats twice a day. He doesn't have free food all day.
Well, when you have an obese patient, right, the first thing you don't want to do is say, "Oh, your cat's fat," right? Because clients will take that and they kind of internalize that as you're attacking them, and so it becomes a delicate situation. So you kind of just you tiptoe around it, you dance around it, and then you say, well, I'm just noticing here that we may be getting a little extra calories in our diet. How much are you feeding? I engage it by basically mentioning it, and then I quickly go towards a question, such as, I notice we're overweight. How much are you feeding? And then all of a sudden it's, oh, maybe this is something that I can change, not so much as, what are you doing? This is bad. And a lot of clients don't realize that, that these patients are overweight. It's client education, and that's my job.
Well, let's see here, huh? So we're 25 pounds now?
Yeah, I know. He gained weight.
Buddy.
So
And lately his appetite has been off.
Okay.
So, and he's like fussy too. I mean, he likes freshly opened cans, nothing that's been in the refrigerator all day, nothing that's been on the counter for
Okay.
a couple of hours. It's just like really super finicky
Okay.
about that.
Oh, buddy. Well, what I would...
Tried heating it up and
You have?
doesn't want to hear it.
No, not even the
No.
heated up food. Okay. Hi. How you doing? So what I'm going to do is my physical exam, and then afterwards we'll talk about things that we potentially could do to maybe assess what our metabolic function
Yeah.
is doing,
Yeah.
and usually that requires some blood work. Okay.
Okay.
All right. And then we'll get down to the bottom of it.
Okay.
I'd like to do the blood work first, and then we'll go from there. We could do in-house, CBC, chem. And I'd like to also get a urinalysis, and we might actually need Christina to try and do a ultrasound guided fine needle aspirate of the bladder, because we are a 9 out of a 9 obesity, so it's going to be hard to palpate that unless we just want to get some urine that way.
So we have Swifty here who needs a workup. So we have him here in the hospital right now, and he is quite obese. So it will be a challenge for us to get some blood work that he needs done. So what I'm going to do is just shave a little bit of fur on his throat area to take access to what we call the jugular vein. It's easier to do a jugular vein stick for blood work than the legs on obese patients, so it's just easier access. It's a larger vein, so just clip a little bit of hair, insert the needle, and then we'll draw the blood. Okay, little stick. Good boy. Okay. Good boy.
You're a very good boy.
Good job.
Oh, that's cold.
I can hold it. Okay. Put the request
And
in.
now we're gonna bring him into the ultrasound room and take some urine out and look at his bladder. We are taking some urine out of his bladder. The way we need to do that, because he's obese as well, is we will stick a needle into his bladder through his abdomen, and we will do it via ultrasound. So because of his size and we can't feel a bladder on him just holding him normally, we need to use the ultrasound to see where the bladder is placed, and then we'll retrieve the urine that way. Good boy. Okay, I'm going to shave a little spot on his belly.
Good job.
Okay, now we're gonna see if he's got a full bladder. See what that looks like, and if he does, then we'll do a cystocentesis, which takes the urine out of his bladder so we can get a sample.
It's okay.
It's okay, buddy. You're doing good. Okay, so here's his bladder right here. It's a good size, so we should be able to get a sample.
Hey, 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 hey.
It's all right, buddy. It's
Okay,
okay.
buddy.
It's okay, bud.
I know. Hey, it's okay. Good job. I know, you're being brave.
Okay, so we do have a
Good job.
sample here. This is some of the urine. We got a good sample. You're a good boy. And now we'll just take a quick peek and see if he has any crystals or stones or anything in his bladder. Okay, so this black here is his bladder. We don't see any snow or flurries, what we call them. No crystals, no stones. So it looks like he's got a pretty good clear urine. So we'll send this sample off to the laboratory and we'll see if he has any active infections or anything
I know,
that
but
we're
it's
missing.
okay. I'm
So
gonna
let's
clean
just
you up.
clean him up here and then he will be all ready to go. You were a very good patient. I know. You're a very good boy.
You are a good boy.
And he is all done. So we got his blood work we'll run the urine, and we're all done. It is extremely common for us to do ultrasound-guided cystocentesis, that's what we call it, and that's how we retrieve urine out of the bladder. One of the reasons why we do it is because it's a sterile procedure. We can send it off to the laboratory to tell us if there's an infection going on, versus what we call a free catch urine, where they just void themselves. So all around it's better for the laboratory results, and it doesn't hurt the patient. It sounds a lot worse and looks a lot worse than it is, and we do quite often. I would say anywhere from 3 to maybe 10 a day we do of those.
All right. So we still have to do an X-ray on him. Can I set that up? Yeah. Okay. looks like there's a lot of stool going on here. So it looks pretty good. So now we're just gonna
Yeah.
get him on his back so we can see how that looks.
Take a picture through his belly.
Okay. So we're just gonna position him on his back to take the VD.
Good boy.
It's okay.
You're all right.
I know. It's not, we're not doing this.
He's like, Karen, save me.
I know. It's hard to want, yeah.
All right, buddy. It's okay.
Alright, you guys gotta put this
Here.
Alright, and shut the door.
He's a very tolerating cat. He lets us do anything to him. He has been very nice. We call kitty minutes in a cat. He has a lot of kitty minutes, and we all appreciate that.
That takes, so.
Didn't take it off.
No,
Nope.
so we're just gonna
Didn't
redo
do anything.
this. We're
Sorry.
just gonna redo this one again. What are we doing wrong?
Does it take?
We're having problems. If it's not taking.
So having Swifty in the x-ray room is definitely an interesting situation. We have very specific measurements and guidelines for what creates our x-ray picture, so how to penetrate and how quickly to penetrate with our electrons. And the more obese our patient is, the more difficult it is for our electrons to penetrate as quickly as they need to so that we can have a clear picture of what's going on. And because he was so fat and had such a large fat pad, we could not penetrate very well, and we had to increase his measurements a few than what he actually was to be able to see a good picture in here. And thankfully, now that we've increased his numbers, we have a very ideal picture of what's going on in his belly. Finally got some pictures of this kid. He is pretty obese, so to penetrate all the way through was kind of tough. We had to change his numbers a bit.
It's all right. It's good exposure. So this area right here is actually just all feces packed, and borderline megacolon. Cats can get megacolon, and it's basically when the enteric nervous system, which are the nerves which basically innervate our GI tract, are not working properly, and then it stretches and stretches, and then basically they're not able to really push it out, so they need help pushing it out. So we give them lactulose and any laxatives that can basically help push that along and smooth things up, and actually take these firm fecal balls and actually soften them up so they can actually come out some more. And so we're gonna have to go talk to Mom about that. With the radiograph, we noticed that we saw that there was an intense amount of fecal material in there, and to the point where it was borderline megacolon. Okay, and so megacolon is when the feces are so impacted in the colon, and it stretches so much that they can't actually propel that out with normal peristalsis, and so what happens is they need assistance, and a lot of times it's recurrent, doesn't go away. So this patient, we needed to go in there and we needed to do an enema. And by doing an enema, you basically stick a red rubber catheter rectally, and you lube up everything in there with some saline water and some sterile lube, and in hopes that the body is going to flush all of that out. And then we send home with some extra laxatives, and then we're going to do a recheck and follow up on that. All right, team. So for Swifty, since we already got the radiographs of the abdomen and we noticed that there's a lot of feces that are in there, we basically are going to want to do an enema today as well. Thank you guys for getting the urine through cystocentesis through ultrasound. The blood work here looks basically unremarkable. Everything looks pretty normal. There are a couple of high values, but they're mildly high for the calcium, the ALT, and the cholesterol. I'm not too worried about that. So the treatment plan for today is we're gonna sedate to do the enema, given the approval from the owner, and then what we're gonna do is we're gonna send home with a little bit more annulose, which is the laxative, which is gonna help. We're just gonna give it a little bit more frequently, and then that's also gonna be after the enema. And then we're gonna have to remind Mom that when we go home, that we just try and keep this one in the bathroom, because there's going to be probably a lot of poop coming out soon. So
He has large fecal balls at the end of his colon, so Dr. Hamilton and I kind of decided that the best course for him would be to go ahead and give him an enema, relieve him a little bit. Maybe that would make him want to eat better at home, because that was another presenting complaint. So hopefully we can give him this enema and make him feel a little bit more comfortable.
All right, are we ready?
So for Swifty, we're gonna sedate with let's see, with dexmedetomidine and butorphanol and ketamine. It's called Kitty Magic, and it sedates them pretty well. Where you can do some short procedures.
Hey, buddy, can I get you on your side?
Where you need them to be completely
good boy.
still.
Good boy.
You're doing good. You're doing very good.
Good boy. Okay.
Excellent.
Yes, we're gonna go night-night. Take a little nap.
Here we go.
It's okay. We're gonna make you feel better. Yeah.
Now it's going to be coming out of the tip here. The goal is to stick it in the anus and the rectum as far as we can, past all the hard stool, and then inject this, and it's going to soften everything, and then eventually we're going to basically poop. Let's go here, search right here. Here's the anus. We're just gonna feed it in, and we're gonna kind of also basically infuse this at the same time. Okay. That's good enough. Now we're just gonna go slowly infuse all this. It does leak out. You want to be gentle because cats' rectums are very thin, and you never want to push too hard because you can perforate their rectum. As you can see, it's coming out as I flush. Softening the stool. The patient will not have a bowel movement right now while we're sedated and while doing the procedure, but we will shortly. And after these procedures, we recommend they stay here in the hospital, so if anything does happen, it doesn't happen all over the patient's, the owner's home, but they will have to go to the bathroom, and it can be messy. So we recommend that if they do take them home, that they isolate them into a room, a small room such as the bathroom, where if accidents happen, it can be easily cleaned, versus on the bed or all over the house. Pull this out as I'm infusing. And that is an enema. This is the reversal for part of the sedation, so we're gonna start waking up sooner rather than later. And I like to go into the epaxial muscles where I find the spine and I find the point of the hip, and I go right in between the two into the muscle. Pull back, make sure I'm not in the vessel. Administer. So this one should be waking up, I'd say in about within the 10 minutes, 10 to 15 minutes. Okay. All right. The weight is still probably going to be an issue. I told the owner to cut back however much we're feeding now, even more so by 25%. You never want to cut food back too much. Or too fast, especially with cats, and because if they lose interest in the food that you're feeding them, or if you change the food, they will go on strike. And cats that don't eat for greater than 3 days run the risk of developing hepatic lipidosis, which is a condition in the liver where the body breaks down the fat that the fat stores, goes to the liver, but the liver can't process all of that fat. It's just too much, so it stores it in there, and then the liver gets enlarged and starts working not properly. So long story short, yes, when I enter a room and there is an obese patient, you have to be delicate with that situation, and then moving forward, and in the room, it's on the fly, and that's what I love about my job. It's like the clients will tell you one thing, patients telling you another, and then you have to use the blood work and other diagnostics such as ultrasound to discern what's really going on with the patient.
Bing is actually getting neutered today.